The California and San Francisco Departments of Public Health and the CDC have confirmed that a recent case of COVID-19 among an individual in California was caused by the Omicron variant.
The Omicron variant has been detected in the U.S. Health officials say the patient recently returned from South Africa, where scientists first identified the variant in November. COVID cases in the U.S. were already increasing since late October, and were averaging more than 90,000 a day before Thanksgiving, when millions of people traveled to gather with family and friends. Hospitalizations have been creeping upwards as well. Even before the variant was confirmed in the U.S., the CDC strengthened its booster recommendation, saying that everybody 18 and older should get a booster shot. We've also seen some tighter travel restrictions and mask advisories in places like New York. There's still a lot about the variant that we don't know.
With the small number of cases, it is very difficult to know whether or not this particular variant is going to result in severe disease.
Researchers are concerned about the variant because of its high numbers of mutations, some of which have already been linked to higher transmissibility or a partial evasion of the immune response from vaccination or prior infection with other variants. President Biden said Monday that his administration was working with Pfizer, Moderna, and Johnson & Johnson on plans for vaccines or boosters in case they're needed to combat the variant, but Mr. Biden said that as of now, officials don't think such measures will be needed.
I will also direct the FDA and the CDC to use the fastest process available without cutting any corners for safety to get such vaccines approved and on the market if needed.
Health officials and infectious disease experts were already anticipating an increased number of COVID cases and hospitalizations this winter, as colder weather ushers people in many parts of the country indoors and people gather together for the holidays. Public health officials say that the things that we've been doing all along to help protect ourselves against other variants, including Delta, which is most of the cases in the country right now, can also help against Omicron.
CDC continues to recommend wearing a mask in public indoor settings in these areas, washing your hands frequently, and physical distancing.
We don't know a lot about this variant right now, but researchers across the world are working on it, and we should have more answers in the next couple of weeks.